to the public and the viewers? And also, which perspective now can we speak it so that people can fully understand this, and giving us a few statistics that can trigger the public's attention?
Thank you so much, Mr. Daniel. Yes, dear viewers, as you have been told, my name is Dr. Mbuka Abdallah from Kisubi Hospital, Department of Medicine. So we are the people who assess different conditions. My department is the one that does the thorough screening and the treatment of different conditions. And today, as already said, we're going to talk about a killer disease. I think cancer is described as a killer disease by most of the people, right? And to start with, we need to tell people what cancer means, because we have got different people in our facility with the, can I call it a pimple? And someone tells you, so, you know, cancer. But we want to tell people, I think we start by telling them what cancer means, right?
Please do.
So, dear viewers, the word cancer, the other medical term is malignancy. I think that's why if someone wants to mean that I'm so tough or you are so tough, they will say you are malignant. So cancer means it is a group of diseases. It's not a single disease, though the science is the same. Because we know very well, I assume that the public knows that cancer can be in any part of the body. So whatever the location of this cancer, cancer means that your body cells, in a particular part of the body cells have got the capacity to divide and become many without the control of the body. I'll make it more clear. So, and these new body cells we have formed have the capacity to eat other tissues, to eat other surrounding tissues, or even move to other body parts and destroy those body parts. What do we mean? Viewers, we are made up of body cells. I don't know whether you know that.
Yes.
For you, are looking at the head, but first we look at muscles, cells in the skin, cells in the bones. You are looking at the chest, you are seeing bones, of course, cells in the bones, in the lungs.
I remember a simple anatomy of cells, tissues, organ system, and the body.
Thank you so much. So the function unit of a human body is a cell.
Yeah.
We are made up of different organs. That is, how many organs? There are very many. The liver, the brain, the lungs, the kidneys, all those organs.
And the sexual organs.
We talk about them?
No.
The reproductive system.
You left them.
Those organs, sexual organs, all of them, the skin, all of them are made up of. Finally, when you look at an organ, the final functional unit is a cell. So I want everyone to first understand that we are made up of cells. That's why the Baganda call cells obutafali bw'omubiri. Kubanga bwebuzimba omubiri. They come up together to form the whole body. So these cells, they are highly organized. So the body has capacity to control because the normal cells, just imagine, Mr. Dan, when we were still young, we were small, but now we are big. What happened? Because the infant has a head, just like I do, but theirs is small compared to mine. So meaning that as we grow, it is these cells to divide. So cells divide, and then time comes when they are no longer dividing. That's when we reach maybe maximum maturity, not so? But then in the due process, a cell can divide and it die. Maybe you have got an injury, cells can die. An accident of the skin, cells die. So the cells have to be replaced. Meaning that in our body system, there's something we call cell division. There are circumstances whereby cells are supposed to divide. Maybe they have been injured or they have died because of maturity, they have to divide. So the process of cell division, cancer means that in the process of cell division, a particular cell, a body has lost the control over that division. So cells divide anyhow. So in the long run, this cell can divide without the regulation of the body. It forms a mass. That's why when you talk about cancer, people think of a mass. Maybe Shizimba Wano. But of course, cancer can be in any part of the body. But the key point is there is unregulated cell division. And the new cells we have, the new formed cells have the capacity to do whatever they want. Let me use that term. We form new abnormal cells that have the capacity to do whatever they want. So that's what I can say about cancer. I don't know whether people have understood it.
I have always understood it.
Division of body cells in a way that the body has no control over. The body has lost the control over cell division because a normal cell is controlled, highly regulated. cells should only divide where they should. Maybe there's an injury, or some cells have died, we are replacing. If 4 cells die, we must replace 4.
Only.
The system is there. In case we form the 5th one, we kill it. So the cell division is highly regulated. However, in circumstances whereby that control over cell division is lost, then this new cell can divide abnormally when it is done controlling itself. So in that process, it can lose its function. Assume, let's pick one organ, maybe the liver.
Yes, the most common talked about.
Yes, the liver maybe. So the liver cells, hepatocytes.
Hepatocytes.
In case there's liver injury, some cells have died, it is okay, they can divide to replace. But in a situation whereby a cell has become cancerous, it can divide and divide and divide without the control of the body. And also, it doesn't stop on that. The new cells that are formed have the capacity to move from the liver to the brain, to move from the liver to the lungs, to move, assume the cancer was in the ovaries, it can move from ovaries to the brain. So cancer is a bad disease, we shall say that, because it is toxic. The cells, the new cells formed have the capacity to destroy the rest of the body. So that's the brief information about cancer.
How does the body respond to the abnormal cell growth?
Thank you so much. Normally, the body has strict regulation of the normal growth. So now, because we haven't talked about the science, why has this mistake happened? Because abnormal cell division happens because of a mistake in the cell division. And usually, the body responds to abnormal cell division by killing the new cells formed. First of all, it tries to prevent formation of the abnormal cells. But if the cells by mistake are formed by mistake, the body has what we call apoptotic mechanism. Apoptosis comes in and will destroy those new cells formed. So a cell has a lot of regulators. Maybe I can use some scientific words. Before something which triggers a cell to divide is called a growth factor. If a cell is to divide. But this growth factor, when it tells the cell to divide, before the cell divides, we have policemen of the cell, P53, ABL. They first show me your DNA. Is there any abnormality? Are you going to become abnormal? Because every cell has DNA. So if something wrong is in the DNA, yes, your DNA is not good. It will call the apoptotic mechanisms and will destroy it. Yes. So cancer means that process which regulates cell division and killing abnormal cells has got a defect also. So meaning that the gist of the matter is cancer happens because your DNA has been affected. Has been affected. So it has lost the capacity to regulate cell division.
Now, what brings the DNA alteration?
Thank you so much. I think that's what we should know most, because if we know it, we can avoid cancer.
Let's now go there.
Let's go through that. So, dear viewers, every cell has DNA, and the DNA is the transcript with all the information someone has, all the characters you have, the height, the color, the what. It is stored in DNA. So DNA controls everything.
The beauty. That miss out such important.
Yeah, the beauty, the height, okay, all that is controlled by DNA. So in a situation where, some of the things DNA controls is cell division. And we have said that in a situation whereby DNA has lost control over cell division, that cell can divide abnormally without the control of the body. So what are some of the things? Okay, what are some of the things that can destroy our DNA such that it loses the control over cell division? So we call those ones carcinogens. I think the word cancer and carcinogens have that similar sound.
Yes.
So a carcinogen is any substance that has the ability to destroy your DNA and that of that particular cell, such that DNA has lost control over cell division and the cell divides into cancer. So the carcinogens commonly, one, they are very many. That's why cancers are common. Maybe I didn't give you a preamble that we chose cancer because cancer is one of the leading causes of death worldwide, not in Uganda, but worldwide. Of course, in adults, still the things concerning the heart are still top. Cardiovascular risks are very many. People are getting heart attacks, people are getting issues, so they are dying. But cancer is the next. Actually, soon it will be the leading cause because of the increasing number of carcinogens we are going to talk about. And that's why Kisubi Hospital tries to, after identifying that cardiovascular problems are very many, it brought a very good heart care. Kisubi Hospital, we will have a camp this very month, 13th, 17th, to screen the heart. But also we are using this chance to talk about cancers as the next leading cause of what? Of death. So, ladies and gentlemen, things that can damage your DNA and cause cancer.
The carcinogens.
Carcinogens are actually everywhere. They are the things you do in the routine. So we classify them mainly into 3. So carcinogens, some of them can be infections. Do you know that? We have, when I say infections, I mean these germs, bacteria, virus, and all that. So there are very many, but we have some few viruses that we have identified that they have the ability to cause damage to DNA. So group number 1, infections, especially viruses. And we call those viruses oncoviruses. Onco from that oncology. Oncology means cancer, study of cancers.
So they have the capability to cause cancer.
They have the capability to destroy your DNA and cause cancer.
Not every virus has the capability.
Not every virus. So I'll mention a few of them. So the first virus that causes cancer is called human papillomavirus. That virus which affects the cervix. So cancer omwagwanabana ebitundu 9 ku 10 n'okudda waggulu biva ku virus bagita HPV, human papillomavirus.
Tujijawa.
It is sexually transmitted. So era kyola abantu abamu batya nnyo HIV, batya nnyo ki olindiri gye batya abalala oba gonorrhea, omusajja yafunye enziku bagita nnyo. But for us as medics, we know that there's a virus called HPV which causes cancer. Yet everyone knows that cancer is a deadly disease. We shall discuss its deadliness, why people fear it, and I try to explain to them why they shouldn't fear the cancer itself, but they should fear delayed detection of cancer, because cancer has stages. So yes, viruses, HPV, it causes cervical cancer. That's why we advise all women out there to screen for HPV. Are we together? All women out there should screen for HPV. If those who are not sexually exposed, we advise them to get immunized against HPV.
How about men?
Men?
How about HPV and men?
Men, the same HPV causes penile cancer. It's only that these days circumcision and all those behaviors, the receptors have been, the number has decreased for men. But HPV causes penile cancer, and the treatment is to cut off the big man. So therefore, one of the treatment, no, I won't conclude. But one of the treatment, you may lose the big man, if not the life. So, but HPV causes cancer more in women than men, but it can cause penile what? Penile cancer, cancer of the penis. And yes, we advise the parents to take their children, 9 years, 10 there, to go and get immunized against HPV, because cancer, especially cervical cancer, is a very, very bad disease. So that's one virus. There's another virus, even HIV itself. There's a special cancer associated with HIV. It's called Kaposi sarcoma.
I was reading on the cancers that are leading here in Uganda.
Yeah.
And Kaposi sarcoma is
actually there.
Is number 2 in men.
Yes. Because number 2, prostate.
Number 1 is prostate.
We have prostate cancer, we shall talk about it. Then Kaposi sarcoma is just there.
Number 2.
And actually, that one is more in people with HIV positive. So therefore,
both men and women.
That one has equal opportunity. So that's why we encourage people who are HIV positive to strictly adhere to their treatment, because part of the treatment of Kaposi sarcoma is actually adherence to your treatment, such that you do viral suppression. That's the power of adhering to your treatment, just for HIV. Then we have other viruses. There's a virus called EBV. I don't know if you read about it. Epstein-Barr. That one causes Burkitt lymphoma, and people have. You find the kids with a large mass here. Actually, Burkitt, I think, was a Ugandan oncologist. First, it was discovered from here, so it was named Burkitt lymphoma. It was discovered in Uganda. So it's caused by virus, as the oncovirus, as the carcinogen, in quotes. Other viruses, but then...
Where can these children get to the Epstein-Barr virus?
Epstein-Barr is mainly through the contact, because remember...
Aerosols.
Aerosols, fluids, so... It's not sexually transmitted, but any contact you can get it.
Even adult people can develop
They
it?
can develop, but though you have seen that it causes more lymphoma, more in young children. Then we shouldn't forget a virus called hepatitis B and C. Hepatitis B and C, those are one of the things you should screen is very well. But hepatitis, the word hepatitis, we said liver cells are called hepatocytes.
Yes.
So hepatitis is actually a virus that can cause infection of the liver, inflammation of the liver. Its problem is it can cause liver cancer. Personally, I've seen very many of liver cancers. I actually don't know. I've seen very many liver cancers, and the risk factor, of course, liver cancer is from alcohol, which I talk about. We're still on the category of viruses. We are coming to chemicals. But under viruses, liver cancer is hepatitis B and C, mainly hepatitis B. Then, and very many other viruses. Category number 2 of carcinogens, things that have scientifically been proved to damage DNA, and DNA loses the control, alteration, what we call a mutation in DNA. DNA loses the control over cell division, then the cell divides the way it wants, and it does whatever it wants, causing cancer. The others are chemicals. And the 2 most important chemicals is alcohol and smoking. So alcohol has that ability. It is fat soluble. It's a universal solvent as well. It can enter inside the cell and damages DNA. So we have seen several cancers that are associated with alcohol.
So how long does a person need to take alcohol that can damage the cell structure?
Thank you so much. Damaging the cell structure or causing cancer, they're 2 different things. Because every time you take alcohol or smoke, you damage cells.
Hey.
But now I want to take you through the stages. For you to develop cancer, by the way, there are some stages.
Please do.
So when we damage, there's something we call adaptation.
But we are still on chemicals.
We are still on chemicals. So we shouldn't lose. We are still on chemicals. If the more I continue or persistently introduce a certain chemical to my body, it damages my cell, especially those ones that are proved to be cytotoxic or DNA toxic. Before cells become cancer, they first do what we call adaptation. Adaptation, we shall say, okumanyira nti amawugwe oba ekibumba, it was mainly created to metabolize drugs, food, and all that. But for you are giving it alcohol every day. So it has to adapt. So cells, there is a way cells change in size to ensure that they can handle the alcohol. You see that?
Like if you change to another country,
yes,
there is a way you want to adapt to the environment, the climate.
That's the point. That's adaptation. First we call it metaplasia. Because I'll give you the path of cancer from metaplasia, adaptation, to dysplasia. Cells are now changing, becoming bad, then to cancer, carcinoma in situ and cancer. You find that every time I use this chemical, alcohol, cigarette, and others I'm going to list, cells first adapt. So in the process of adaptation, that one can take long because a body has DNA. It has to first fight. As we said, when there's an injury in DNA, the mechanisms come in and destroy these cells that are damaged. But time comes when the rate of destruction of DNA is higher than the rate of compensation. So we end up developing into the cellular changes and cancer. So something to note that how long does it take to damage the cells? I want to assure that every time you take these scientifically proved chemicals that damage DNA and cells, every time you take them, there's damage to the what?
You've increased your risk.
Yes. However, the body tries to adapt. You undergo. That's why, let me use this chance to talk about cancer of the esophagus. Waliwo cancer w'omubiri wabika bibiri. Oweno waggulu n'owa wansi. So cancer oyo commonly it is caused by alcohol. Owa waggulu. And smoking, naddala nga byegasse bibiri. Then owa wansi omubiri gye gusembera eri, it's mainly caused by acid reflux. Now on wa wansi ono, because of the acid reflux, but acid reflux webeerawo eyo, webeerawo damage to cells. What cells do, they change to a new quality that can outweigh this acid that keeps burning them every day. So initially, for us to call them squamous cells. They are squamous in nature. Now they change. They become columnar. Because columnar have the ability to secrete and absorb that acid. So that kind of change is happening. I want to use that as an example. That if you take that example, acid is burning the lower esophagus. Cells have to adapt. such that they can win this acid. So, however, if the burning continues, then they can finally give up and you get cancer. So therefore, every time we take a carcinogen, there is damage, but the body tries to adapt. That's the message. So how long does it take? The body tries as far as it can. Even it can take years and years. That's why people out there will tell us, doctor, I have smoked for
20 years.
20 years. Oh, I'm okay. I don't have any problem. That is okay because cells are adapting for you. The time they will give up, you will get the cancer. So therefore, it may take a bit long to get the cancer, but the damage is continuously happening every time you take that carcinogen.
Number 3.
Number 3, still under chemicals. Chemicals, by the way, smoke has very many chemicals. There are very many. The amines, nitrosamines, asbestos. There are very many chemicals that have been proved to be carcinogenic. They can cause cancer in that smoke. But for us, we just call it smoke. But smoke has a lot of chemicals. I think people look into the chemicals in that smoke, and most of them are carcinogens in nature. Then the third category of the carcinogens or things that can cause damage to the DNA and cause cancer are the radiations. Radiations, that's why we also use radiations in a hospital setting, but you have to ensure that the dose of the radiation is calculated and also the frequency. However, people who are ever under UV light, because our light has a lot of different, it's a spectrum. So part of the spectrum, most of the radiations are, if there is prolonged exposure to such radiations, they can increase risk. They can penetrate into the cells, damage DNA, cause cancer. So basically, that's the overview of the fact that it's about DNA damage and things that damage DNA live with us. We have them.
Excellent. Thank you so much, Dr. Abdallah. We go for a short, quick break. When we return, Dr. Abdallah will tell us how free radicals from the food we eat can actually bring out cancer. See you shortly.
Good Day TV, transforming your life.
Wayagala ebyuma ebirungi ebyogera Pasita Pasiteri atunenanga engoma n'enjita zonna Pasita Pasiteri amplifier n'emizindalo Pasita Pasiteri ebitala bya siteeti ebyebika byonna Pasita Pasiteri ebyuma bya Ivetsi tubirina byonna Pasita Pasiteri awunyudde wa sikirini tupangisa Pasita Pasiteri ku kizimbe kya Newmark William Street Pasita Pasiteri kati ndogendayo musajja mwesigwa kituufu endo gye gisoboka ekibanja mpola akikwata wagula ebyekkanisa jangu ewa Pasita Pasiteri
tusangibwa ku kizimbe kya Newmark ku William Street ku ground floor room number N31 opposite DFCU Bank. Esimu noti 782 00 84 ne noti 752 00 84 wano wokka we tusangibwa.
Don't miss on Guguda TV.
From Woman Blossom annual getaways, the summits, the planning and prayer retreats, we bring to you an amazing Woman Blossom TV show. In a world where women are demanded so much, it is time we paused, healed and blossomed. Join me, Giftina Kayinga, every Sunday 5 p.m. live on Guguda TV as I bring to you an amazing Woman Blossom TV show.
Don't miss on Guguda TV. Guguda TV, transforming your life.
Once again, I want to welcome you to Google Data Vision Health and Beauty program every Wednesday at 9 p.m. with me, Kamara Daniel, with a wonderful smile so that you can be healed. Actually, healing is beyond the hospital setting. This smile itself can actually heal you and inspire you to come to Makerere Gospel Church so that you can be saved and come closer to God, as we do not only heal you spiritually but also physically, as we bring you specialists here. For example, Dr. Dara from Kisubi Hospital. Dr. Dara, before we left, we had talked about the three, categories of carcinogens that alter the DNA. But let's talk about the bit of nutrition. The bit of nutrition and the free radicals.
Thank you so much. The bit of nutrition is complex. I use that term. Because there's a saying that what we eat
is what you are.
Exactly. So most of these foods actually contain substances. I want to use a simple language for the public. Very many foods contain substances that have the because the body, its role is to filter. Every time we eat, it is the role of the liver to ensure that all the toxic agents of food are removed and actually eliminated out of the body. However, I want us to agree that a lot of foods have harmful substances. Let me use that word. And especially there's an element of something we call free radicals. So some foods have the capacity to give us free radicals, which have the capacity to destroy
the DNA.
Which have the capacity to destroy DNA. But unfortunately, many of them, scientifically, they're not yet known. Maybe the help of nutritionists and other, we call it multidisciplinary team. We can come up with a list of them. The few that are known, the asbestoses, the arsenic, there are very many, of course. It's a long list. They have the capacity to generate free radicals and damage DNA. Because at the end of the day, the problem is DNA damage, mutation. And I want to take this chance to inform everyone that many foods we eat have carcinogens.
Yes, maybe about the foods here in Uganda, we've actually found out that the more you reuse the cooking oil, especially the vegetable cooking oil that we have in the market, it becomes, carcinogenic. It absorbs the air and then it makes it free radical. So that's when you take it. For example, there was a study that was done on the foods that are sold on the streets. Most of them tend to become carcinogenic because of the cooking oil that is reused 3 times, 4 times. The more you reheat it, the more you break down the saturates that are inside, and so much more. Hey, wonderful discussion today. Me, I'm a student today, and I'm so keen on learning. So for viewers, just what you do, go on our social media platforms, Google Television Uganda, LinkedIn, Facebook, Twitter, TikTok, so that you don't miss such wonderful engagements with the experts. So, Doctor, we've explored very many things now. Which part should we go to next? Risk factors? I think we've explored them.
Risk factors? Yes, we have
explored them. Let's explore common cancers in
Uganda.
Common
cancers, how to know that someone has cancer, yes?
Yes.
So common cancers in Uganda, one, we should know that cancer can affect any part of the body. Is that okay? As we have said that every part of the body is made up of a cell, that means that every cell in your body is prone to cancer.
Yes.
However, we have the common ones that you have seen. So in men, I'll first say worldwide, the commonest cancer is in men, prostate cancer. And in women, breast cancer. So very many women out there have breast cancer. Others are developing breast cancer, but they don't know. Then in women still have cervical cancer. Then Kaposi sarcoma geno comes in. Then liver cancer is also there. So, and you can see that most of the cancers we have in Uganda, many of them, the carcinogen is known. Many of them, some carcinogen, most of the carcinogens are known. Then we shouldn't forget that we also have lung cancer, very common. And in terms of mortality, lung cancer is the one internationally with the highest mortality. I think because it is affecting the oxygen part. So when you get lung cancer, in most cases, the survival chances. Okay, when we say survival chances, we mean advanced stages of cancer. We should talk about the stages of cancer. People should know which stage and all that. Because what people fear is mainly the worst form, the stage 4 cancer. But if it is peaked in carcinoma in situ stage 1 there, people survive from cancer. But the problem is we delay to seek care because I think we don't know how cancers manifest and all that. But those are some of the commonest cancers in Uganda. However, every part of the body has cancer. If you go to Cancer Institute Mulago, you find a lot of, if you go to UCI, you find a lot of esophageal cancer, alcohol, and GERD. People have something they termed as ulcers. Ulcers, every time someone gets pain here, ulcers, actually, the word epigastric pain is now synonymous to ulcers, not so in Uganda.
Yeah, which is
yet sometimes someone has acid reflux that can persist for a long time and increase the chances of metaplasia, dysplasia, and then cancer, adenocarcinoma, parietal esophagus, and then adenocarcinoma, cancer of the esophagus. Then also that system of GIT, commonest cancers, cancer of esophagus, cancer of the stomach, and cancer of the large intestine, colorectal carcinoma. All those are very common cancers. Then even the brain is not spared. People have cancer of the brain. You find someone with headache, they are ever convulsing, they have never done any imaging of the brain, and there's cancer. However, in a nutshell, in Uganda, commonest women, breast cancer, men, prostate cancer, Kaposi sarcoma, liver cancer. Those are very common cancers in our country.
Since they are very most common cancers, doctor, we need now to give them telling points to show that you are likely to have breast cancer if you have the following. You are likely to have prostate cancer if you have the following. Like 3 pointers per cancer so that we can, run around together.
Actually, we can use that chance. As Mr. Daniel has said, we are going to talk about the key symptoms.
Key telling pointers.
Key telling pointers. One can tell that I think someone has cancer.
Let's begin with the breast.
We start with breast?
Yes.
Okay. So as you have said that cancer is a mass. Cells have divided and then they are formed a mass. So breast cancer, ideally we expect a mass in the breast. But remember, a cell is so small. If you know, a cell is something microscopic. By the time one cell divides, and it becomes solid, it means it has undergone very many divisions. Actually, science tells us that you need 30 divisions for you to start feeling. Like when I say that, I mean one cell has got the DNA damage, so divide is once to form 2 cells, 2 become 4, 4, 8, 16, like that. You need that of like 30 times to get symptoms. Therefore, we should not wait for the breast to have a mass. However, there are some parameters that you can have that can tell you that I think I have
Cancer
of the breast. Number 1, breast lump. Like when you palpate yourself in all the quadrants of the body, you feel that there's some solid mass. That's why we encourage women to keep palpating themselves. Number 2, tender breasts. Number 3, people get they call them cracked nipples. Your nipple, you find it's fanning out. Then finally, people get discharge through their nipples. You say discharge coming. So then generally, if cancer grows now, because you have carcinoma in situ, then finally it can spread. If it becomes very big, then you can have engorgement of the breast, enlargement of the breast, or a visible lump in the breast. That's about breast cancer. Then for prostate cancer, in men, prostate, prostate, I don't know, you know prostate, how Baganda call it?
No.
Katungulu. That's how men call it. So katungulu of men.
I don't know it even in Runyankoli.
Yeah, so prostate is one of the masculine structure that males have. It's part of the reproductive system to make the sperms healthy.
Nourish them.
Nourish them, give them whatever they need to do whatever. So that prostate, fortunately or unfortunately, it is surrounding the urethra, the tube which brings urine. So some of the symptoms people start with are urinary symptoms. So someone tells you that every time I go to initiate the micturition, the urination, does not come. Because the prostate is big and it's pressing the urethra. Or someone will tell you that I'm ever in
the washroom.
A washroom. Why? They go there for the short call, but urine is the void, the emptying is not complete because there's an obstruction. So, and if there's obstruction, urine, some amount remains there. So as you drink a few meals of another water, the reflex comes that you have to go back. So keep going back. So frequent urination, or sometimes very actually difficult to initiate urination. Some people get discharge, others get blood in urine. Actually, blood in urine. People get, we call it hematuria. They see blood in urine. So all those ones are indicators that it's possible that your prostate is big It can either be cancer or just a normal enlargement, BPH. Though in men, the common one is enlargement of the prostate, which is not cancerous, which is benign, BPH. However, both of them share the symptoms. So it is the role of the doctors to confirm for you that you have the benign form, not the cancer form. That's about prostate cancer. Then cervical cancer in women. I think personally, cervical cancer is one of the cancers I wouldn't wish. No, I don't wish anyone cancer, but cervical cancer is
it's a double burden.
Yeah, because that abaganda bagwita utya mumagwa nabana. Umuganda bagwita mumagwa nabana. So mumagwa nabana bagufuna cancer. Just assume your cervix has formed a mass which is cancerous, which is destroying all the structures there. So one of the bad things. Okay, the initial things we have bleeding in their private parts. Other people get, you are not expecting your periods now, maybe 2 weeks to come, but in the middle, what we call intermenstrual bleeding, you are seeing blood out of the blue. Then during the intercourse, they get pain and bleeding, and also foul-smelling discharge. Discharges, that's why a woman who has a PV discharge, you advise them to go to a hospital, come to Subi, our gynecologist look at you. Is this discharge the normal infections, or this discharge is a special one? Possibly risk of cervical cancer. But those are the initial symptoms. Of course, low abdominal pain and all that. But the worst form, if this cancer grows large in size, they actually get fistula. I don't know, Mr. Daniel, you have heard of fistula. One of the worst complications in women is a fistula, and cervical cancer is one of the commonest causes of fistula. On top of obstructed labor. So I encourage women to go and deliver from hospital to avoid obstruction, because fistula is a bad thing. Fistula means we have three structures there for urine.
The connection breaks.
There are three things there. Now they can connect. You find stool, poo is passing through your private part. Urine is passing through the anus. So that kind of thing can also happen in these women. And we don't wait for the worst complication, but every time you feel you have any abnormal PV discharge, foul smell, bleeding, abnormal bleeding, we call it abnormal uterine bleeding, please come to our gynecologist, hospital, and we assess. Maybe you may have a growing cancer, or we ensure that we confirm that you don't have cancer. Other cancers depends on the location.
Yes, we want now to talk about the cancers in adolescents, in young people.
Young people.
What are some of the common cancers in young people, and how can they know? Because you understand that young people are the most left behind people when it comes to, care, management, and prevention. And me, I'm a young person, so I want to focus on my age group now.
I think if you're younger, you are my fellow young person. I don't know. But young people, yes, are also not spared from getting these cancers. Just that if a cancer is because of a carcinogen, it will be more common in adults because there are higher chances of exposure to the carcinogen. However, young people, cancers frequently happen in young people. The commonest cancers in young people, even children, by the way, even a two-year-old can have cancer. But the commonest cancer they get is there's what we call leukemia. Cancer is known to be more of a tumor, a mass. But remember, even blood also has cells. Do you know that? It's a liquid, but it has the cellular component, red blood cells, white, platelets, all that. So these children usually get leukemia. That is cancer of blood. They also get lymphoma. That's when you talked about Bucky's lymphoma. Yes, we get lymphomas. Other lymphomas can be in other lymph nodes. They get lymphoma so much. Otherwise, they can also get other cancers. I've seen a young boy, actually, we did even amputation. Young boy got cancer of the bone. Got cancer of this bone, osteosarcoma. Yes, they get retinoblastomas. So all other cancers can happen in these people, but they have their common ones like leukemias and lymphomas. Excellent.
Now, we have looked about cancers, and we have explored cancers. Can we now look into the general management and treatment modalities? We shall talk about staging little bit so that we can rush the prevention, a bit of time management.
Okay, thank you so much. Management, I hope people have got the presentation, how cancers, though before I take you to the management part, I'm going to go to the management. There's something I want to talk about, the general symptoms of cancer, irrespective of the location of cancer, because we have seen that symptoms can happen depending on where cancer is located. But have the genuine. People who have fevers. You know, fever is infection, malaria, what? But those fevers that are evening fevers and months, you have fevers, it's a systemic response to cancer. Weight loss that is not explained by anything is a general symptom of cancer. We call them B symptoms. Then evening sweats. People who sweat at night, evening sweats is a general symptom of cancer. So people should, I wanted to mention about that, so that those are not specific for a location, but they're signs of cancer. General management of cancer, should I start with staging? Because management depends on staging.
Yes, please.
We
Let's
stage
do in
and manage.
staging and we manage.
Yes. So, as we have said that, yes, we have confirmed there is damage to DNA by carcinogen. The body is trying to fight to see that the cell remains normal, but it has failed. So the stages it undergoes, one, before it becomes cancer, it changes its functions. Like a cell, it adapts, let's use that term. That now it is in a toxic environment, it tries to change such that it can win the environment. Call that one metaplasia. Metaplasia, adaptation. But then if the carcinogen continues to prevail, to exist, it becomes dysplasia. Its functioning starts to change now. Then if the continuation of, if the damage continues, finally we get cancer.
The cancer.
Yeah, we call it carcinoma. Initially, cancer, we call it carcinoma in situ.
In
The
place.
cancer is there in place.
It is available
where the cell was initially
Present.
located, present, yes.
Now let's
However,
begin with stage 1.
yes. So stage 1, we have 4 stages, whereby we think stage 1, cancer is still, carcinoma is still there, where the primary cancerous cell was. So stage 1, the modalities we have, we can remove the cancer by surgery. We cut the cancer off. If it is localized in one place, we can cut the cancer off.
In stage 1.
It's stage 1. If it has moved around, stage 2 now, it is increasing, encroaching other tissues. We can do a surgery still, but we can also burn the cancers. We have radiotherapy. I don't know the radiation that go and kill those cancer cells and they die off.
And you become
And
normal
you become
again.
normal again. Then we also have chemotherapy. In case it has now moved far, whereby radiations may reach, it may become difficult to cancer that has been here, is now a bit distant. We can use chemotherapy, which looks for the
Cancer
cancer
cells.
cells where they are. And all those modalities are available. And you realize that the chances of survival depend more on the staging.
The staging.
That's why if we can put emphasis to the screening, of course knowing the carcinogens, and then screening for this pathway for cancer, such that we can catch it before it reaches stage 4, whereby stage 4, people know cancer as stage 4. Because stage 4 is this cancer, whereby cancer was in the ovary, but now the ovary cells, cancerous cells, are in the lungs, are in the brain. They move, they break off and move through blood, they access other places.
They're even in bones.
They're in bones. And where they go, the turnover time is just small. They keep dividing because they have no control. DNA that was controlling them got a mutation. So they are doing the toxic part. So that stage is the worst form, and whereby we usually do palliative chemotherapy. So so actually cancer we're gonna meet a kokolo. Because they know cancer as a bad word.
No gamba back to the same.
Back of the sender. No, don't wish them bad. Wish them good. So because stage 4 has moved to multiple places. Why do you think it has moved to multiple places? Yet we have seen that there's actually some good time. From metaplasia alone, it may take years. Cells are there fighting the carcinogen. Then dysplasia, even dysplasia has like grades.
Like
Depending
3
on the
years.
extent, how many cells have been there, like 3 years, because we have CIN1, CIN2, CIN3. It also has stages. It is there waiting for you. By the time it becomes cancer, carcinoma in situ, it also converts from grade 1, stage 1, 2, 3, up to 4. Really, this person has not screened. Symptoms have been
Been ignored.
They have been ignored. Yeah. So we encourage people to I think we have gone through the treatment modalities and also the fact that if stage 4 is the worst form to treat because it has gone to distant places.
Excellent remarks from Dr. Abdallah. Friends, as we intend to come to conclusion of this important program, we believe that you've been able to learn a lot about cancer, the staging, the management, and of course why it is very important for you to go for screening at all stages of your life, ensuring that actually you have self-care. Self-care includes screening, you know. Self-care is not just about eating well, moving out, going to the beaches and whatever. It also includes screening for diseases that are non-communicable, especially the cancers that we're putting on the emphasis today. So, Dr. Abdallah, as we intend to conclude this very important program, we want to come to the prevention strategies, like 5 major prevention strategies. Then from there, we shall also explore the messages to the public.
Thank you so much. This is, I think, one of the most important parameters of the discussion, the issue of prevention, because we know cancer in its severe form, it is really the worst disease you can ever have, in its severest form. However, to prevent it, to try to control the severe form, it is very important that we put our emphasis on prevention. And prevention has steps as well. One, we have to do the primary prevention. We have to do the primary to try to minimize or avoid the carcinogen. I don't know whether Dan, you remember our carcinogens we have talked about. People still remember the carcinogens.
The 3.
Yes, the 3 groups. So if possible, the 3 known groups, because we believe that there are other carcinogens that are not yet discovered, because other cancers happen, and sometimes you look for the risk factor, and it's not obvious. But the known, the scientifically proved carcinogens, ebintu I think kanzire mu Uganda. Carcinogens ebintu bitumanyi ebisobola okukosa DNA scientifically nga kikakasiddwa nti bisobola okwonna DNA eyo. DNA eyo neba nga kyasobola controllinga ngeri cells butafaali gye budividingamu gye bukulamu. So ne bukulanga bwe bwagala ne bulya bunne bwabwo ne butambula ne bugenda wonna ne buleeta kibaita cancer. So tugambye nti twewale, if you want to prevent cancer, twewale carcinogens. The carcinogens commonly we have are the alcohol, the chemicals. If we can minimize alcohol, we shall minimize most of the non-communicable diseases. Because alcohol not only damages DNA to cause cancer, it is the other risk factor for cardiovascular disease, risk factor for most of the non-communicable diseases. So alcohol, smoking, some particular foods, that actually much emphasis will be studied to look at some of the foods that have carcinogens, because there are very many. And then viruses, and we thank our Ministry of Health that they approved, they have got this, they have got this information. Viruses that have been proved and confirmed that they are carcinogenic in nature, they can cause cancer, including HIV itself, including hepatitis B, including human papillomavirus. I encourage everyone to, immunize against those viruses, those that have the vaccines. Ladies, cervical cancer is so bad, and the commonest cause is HPV virus. And there are 2 options. One, you can, those who are still young, who don't have sexual exposure, they can immunize against HPV. Those who have already exposed to the virus, when you expose yourself to sexual intercourse, we assume that you have also exposed yourself to HPV. But it's not confirmed unless you come and we screen. So those who have exposed themselves, please come and we screen for HPV. So we have screening, HPV DNA testing, we have them. Chishu Hospital has them. Even other facilities have them, the big facilities. They can screen for HPV because we know that that cancer is caused commonly by HPV. Number 2, if we find yourself that you have HPV, or HPV test is not there, we can screen for the risk of cancer itself. So that's why cervical cancer screening is very important. We have pap smear, I think you have heard about it. Pap smear cytology can guide us to see whether you are already in dysplasia. You know, I said you have metaplasia, dysplasia, carcinoma in situ, and then carcinoma, the cancer itself. The pap smear can help us, such that if we fail to control the carcinogen, let us control the progression from dysplasia to carcinoma itself. If we are already at carcinoma itself, let's control from stage 1 to avoid going to stage 2. Because the more the stage advances, the more these stages go up, the worse or the worst outcome ever is expected. So therefore, screening is very, very important.
Very important.
For men, prostate cancer, come on and screen for prostate cancer. men know there's a test called PSA, prostate specific antigen. That's one of the commonest screening tool for prostate cancer. Where possible, you can do a scan and look at the size of the prostate. Is it nodular? Is it uniform? How is it? So we look at it. And then if it's suspicious, we confirm cancer. We need to talk about confirmation. People fear that kuja kukanyama. So we pick that biopsy and confirm that cancer or not cancer.
Excellent. Thank you so much, Dr. Abdara. And of course, thank you for being good viewers. Our program is streamed live on YouTube, Facebook, Twitter, and LinkedIn, so that you cannot miss any program, any health expert information about this very important show. Do you have your last remarks about cancer in 2 minutes?
Yes, please. Thank you so much, Dan. Dear viewers, thanks so much for listening. My last remark would be cancer is not the end of life.
It's not witchcraft?
No. But it is the delayed care, or the longer it takes to know that you have cancer. That's the problem now. So it's the delay which is the problem, but not cancer itself, because it has a range, a big room for us to capture it. So therefore my last remark would be about encouraging everyone to screen for the viruses that cause cancer. 2, to screen for the absence of cancer. To screen for the risk of cancer. If cancer is already there, to know the stage such that you can control its progression treatment to the high stages. Yes, let's screen for cancer.
Excellent. Thank you so much, Dr. Abdara. And of course, this has been one of the nicest programs. Personally, I've learned a lot and I've been a good listener. Dr. Abdara must acknowledge my good listening skills. And of course, I have to wish you a lovely time. See you next week. Wednesday, take care of yourselves. I send you my love. Hi.